Welcome back to How We Change the World. This is just a small preamble because I'm thrilled to reintroduce Dr. Caleigh Campbell, a dedicated and innovative physical therapist who has recently opened her own practice, Refined Physical Therapy, to focus on women's pelvic floor issues. Now, here's my introduction. My guest today is my friend Caleigh Campbell, a doctor specializing in treating women's pelvic health issues using physical therapy. Now, if you are female or someone you care about is a female, you will find a world of help here that you may not have known was available. And your doctor may not know either. Now, a number of health issues that impact young female athletes or pregnant and postpartum women, midlife, and even elderly women can be helped considerably with just one or more visits to a physical therapist specializing in this field. Now, many don't require doctor's orders because new physical therapists are now required to be doctors themselves. So please, even if this may not sound like an episode that impacts you, you may, like me, learn a great deal about how our bodies work and how we can get and keep them healthy for a lifetime. So please press that subscribe button first and then enjoy my conversation with Dr. Caleigh Campbell. Hi, Caleigh Campbell.
Debbie.
Welcome to the podcast. I'm so happy to have you here. This is crazy.
Thank you. I'm happy to be here.
For full disclosure to anyone listening, I have known you for a few years. How old are you? Do you mind saying that on camera?
35.
35. So I've known you about 35 years.
Yeah.
Maybe. If anyone asked me how old I was, I would be like, what are you doing to me? But you can do it when you're 35. So anyway, so I have known you all your life, but I did not know what your field was going to be. And I'm so glad to have you on because you're here to talk about something that's really important, that's never talked about on podcasts or really anywhere else. And it's so important, particularly to women, but to people who love women or have women and daughters in their lives as well. So it's really for everybody. So first of all, you are a doctor of physical therapy, correct?
Yes. Correct.
Yes. Because it didn't used to be that you needed to get a doctorate. It used to be a master's when I was going to school. So they've upped that to the big time. Yeah.
Yep,
so
it's a clinical doctorate now.
Yeah. So that's interesting. And your specialty is women's pelvic issues specifically. Is that the right way to say it?
I treat orthopedics as well. My specialty is women's health, pelvic floor, peripartum patients. So that's definitely my passion, especially treating pregnancy.
Okay. So the thing is, we were talking about pelvic issues, and as a mother who's had babies and lived a few years, I really never used the term pelvic floor. And even when you said that was your focus, I'm like, wonder what that means. Because it doesn't relate. It's not a term that we use in everyday life. We'll say other things that happen to fall into that category, but that's not a term that we commonly use. So why don't we just start by talking about what that means? What is the pelvic floor and what kind of issues do people have with it that require physical therapy, which is a whole interesting thing in itself.
Absolutely. So everyone has a pelvic floor, male and female. It is a collection of muscles in the lower pelvis that basically has a huge responsibility, right? So they hold up your internal organs all day, right? They have to have a lot of endurance. They also are responsible for having babies, right? It's the only muscle in the body that expands to 3.5 times its length, which is amazing to be able to have a baby, right? So they also control bowel movements, urination, right? They're responsible for helping with sexual reproduction. So they have a huge array of jobs.
See, I've learned a lot already. I did not know that. I didn't know very much of what you just said, which is shocking. I also didn't understand that men also had a pelvic floor. So do you treat men as well, or is it specifically a specialty for women that you have?
Sure. So it's mostly women. I have treated a few men, but I don't specialize in that. So I'm not trained to perform an internal examination on a man.
Right. Yeah.
However, men definitely have a pelvic floor and they have pelvic issues. And so I've ended up treating a few men just because they've come to me with hip pathology. And then I end up finding out that they had their prostate removed or something along those lines, and they end up with incontinence. And so I do end up treating them. So I've treated a few, but I definitely don't treat very many. It's definitely more and more female.
So this seems to sort of still be a taboo subject, which is a little bit odd to me in this day and age. It's kind of like we have a taboo around mental illness treatment, and I think that's slowly becoming not taboo, mostly because of COVID, and there was so much exposure, and there was so much mental people had so much trouble with, stress and all those kinds of things. So people talk about all the time now about going to a therapist, and it's no big deal, and people encourage each other to. But when you start talking about things like, pelvic floor, or even, I'm not going to get into all the terms. I'll let you get into the terms. But anything to do with this area of the body, we just don't talk about it that much. And or even to the doctors, right? Like people will not, if they're incontinent, for example, or slightly incontinent, or they don't even necessarily talk to their doctors sometimes about it, right?
Right. Or much less mention that they have pain with intercourse, right? That's not something you're going to bring up. Or, maybe you have bowel incontinence, or difficulty controlling your flatulence. Like that's not something you're going to bring up with your doctor typically, unless it's very specifically asked.
Wow. I would think actually that is the one person you would bring it up with, but people don't. People are even shy or embarrassed in front of their doctors. Right. So that's what I really, again, wanted to say, that I appreciate you being here, because I know that I just think it's really important. I think it's amazing that you specialize in it, and that you specialize in it through physical therapy, which is like not a natural thing that people would expect. You wouldn't think you would go to physical therapist for something like that. So, why did you pick it, first of all? Like, why did you choose that particular field as a physical therapist?
Sure. I mean, there's a lot of taboo around it, like you said, and a lot of stigma. So when I was in physical therapy school, I was like, oh, that's never something that I'll do. I'm not going to treat pelvic floor. Like, it was very uncomfortable to me.
Interesting.
And then I was practicing a couple of years for a private clinic, and my boss, one of the owners of the clinic, decided she was pregnant, and she decided she was really interested in women's health. And so we ended up hosting a clinic. This was during COVID. So we hosted a clinic. So there weren't very many places to actually host them at the time. So they were having trouble finding them. So our clinic decided to host it, and I got a free spot in it. And I wasn't sure at first that that's what I wanted to do. But I learned a little bit about how terrible the access is for women, right? Like, even if they end up getting a referral to pelvic floor physical therapy, they have to find a pelvic floor physical therapist, which is very challenging, and they might have to travel really far.
Really?
So I decided that was my main reason, was I wanted the access to be better. And once I learned the benefits and what it could do for women, I felt like I needed to do it.
Oh, that's a great reason to do it, because you're right. I think you'd mentioned to me before that you might get this, I might have a doctor suggest or prescribe that you go see a physical therapist, and then they can't find any even in their state. So is it still a new specialty? Is that why?
Yeah, it is new, and yet it isn't. Like, it's been around a while, I think, because of there being so much, it's not talked about, and there's so much shame around it for a lot of people. That it's just not gotten out there enough. So yes, it's new-ish. It's just taking a long time for it to catch on. Wow. And also for it to be referred. I think that's one of the biggest issues, is traditionally traditionally physical therapy is referred from a physician, right?
Right.
And women aren't going to know. They can come directly to a physical therapist, but they're not going to know to do that. And
they can.
The physician doesn't even know to do that. Yes. So it kind of depends on the state, but that's one of the reasons they moved a physical therapist to a doctorate, was because most states, kind of depending on your insurance still, you can go straight to a physical therapist. So if you had pelvic floor dysfunction, you don't have to go to a physician first. You can come straight to a physical therapist. But they're not going to know to do that, because their physician usually doesn't even know to refer them to PT.
Boy, that's shocking too. There's a lot of shocking things already.
Unfortunate.
Well, I should probably start with a disclaimer that this is obviously not a medical show, and we don't give out medical advice, but you are a doctor, so you could, but you're not doing that. But we are just talking about it, because you have to always put out these disclaimers. So if you think it's of interest, you could go to your doctor, or you could go find a physical therapist who specializes in this and tell them you've learned about it and maybe they could help your problem. So just got to put that out there. So how do you know? So if somebody comes into you, how do you assess like what is their health? Like what is their health need? Is it like a physical exam or what do you do? And is that getting
So
too
when I first
graphic?
started, I was a little bit more hands-on than I needed to be, actually.
Mm-hmm.
And then I learned very quickly that it's much more about the subjective history and everything the patient is telling me. So there's a lot to talk about that first visit. There's a lot of questions, a lot of discussion. It's a lot to do with your brain and your nervous system, and it's not the physical component really isn't that huge. So I do pelvic floor exams, right? An internal pelvic floor exam to assess pelvic floor musculature and its function, sensation, reflexes, all of that. But a lot of times it isn't even necessary. So I like to, depending on what the patient is telling me and what they're coming to me with, I may or may not do an internal exam. So I let them know that it's a tool and we can always use it. But oftentimes it's not needed, and we start to see results within just a couple sessions. And so I don't do one.
So maybe let's go then to talk about what are some of the issues that people come in to see you about. Like what are the issues, I guess? What are the treatable pelvic floor issues for women anyway?
Absolutely. There are a lot, and a lot of people would not have any idea unless they ask the pelvic floor
myself
physical
included.
therapist.
Yeah.
Yes. So incontinence is a big one. There's a couple different types of incontinence. Typically, it's urinary incontinence in females because we're more structurally prone to having incontinence just because of the way our anatomy is, right?
Okay.
And just where everything's positioned. And so it's extremely common. It's not normal, but it's very common. It can happen in a young female athlete. It can happen, in an elderly woman. It can happen really to anybody. So urinary incontinence is probably the biggest one, and there's a couple different types as well. So I assess for those. I also assess for pelvic organ prolapse, which can potentially happen if you have a vaginal delivery of a baby, or it could be something hereditary in your family as well. I also have women who have pain with insertion. So whether that's like a younger woman who can't use a tampon, or pain with intercourse, something along those lines. And I also love treating pregnancy too. What pregnancy does, not just to your pelvic floor, but everything in your body with hormones. It can just wreak havoc
with
on
hormones.
your nervous system.
Not even just the physical delivery, but just the hormonal changes.
Absolutely.
Wreaks havoc.
So it can cause all kinds of issues with nerve dysfunction, nerve pain. It changes the position of your pelvis, the mobility of your pelvis. And then, of course, postpartum, everyone presents differently. I have not seen one woman present the same. Everyone comes to me postpartum with very different issues. Most are pelvic floor related, but again, can be hormonal changes after having their baby, as well as like with breastfeeding. Hormones can also change and cause different effects throughout the body.
Okay. This is shocking to me, almost like all these things that you could. I don't know how do you use physical therapy to treat hormonal changes? That doesn't even seem possible. Yeah.
Yeah, I know it is. People really, it's far-fetched if you don't understand how the whole nervous system works and how to calm down the nervous system. Of course, there's a mental component, and a lot of it is very tied into the pelvic floor when it comes to your diaphragm, the rest of your abdominals, and how the whole system works. When you use your diaphragm, a lot of people have heard of belly breathing, right? So that's one of the first things that I teach people is how to use their diaphragm, because your diaphragm actually mimics what the pelvic floor does. They mirror each other. And so if you're not able to breathe effectively, you're not going to be able to have motor control over your pelvic floor, which most people wouldn't even think of, like a muscle, trying to contract that muscle, right? Like they don't even really think about it. But another side of that that's even more important than controlling your pelvic floor is it's a way of downregulating your nervous system too. So that can help with nerve dysfunction, nerve irritability, but can also help with incontinence and urgency. So it has a major role in pelvic floor physical therapy with anyone I'm treating. So there's all kinds of different things we can do with specific exercise, as well as cardiovascular exercise to calm down nerves that are getting irritable throughout your body because of hormones.
What about, can you work with women who, I'm going to get slightly personal here because some women, and I was one of them, just don't dilate when they have children. Their bodies just don't want to dilate. Is there any way that you could help with something like that? Because you end up having C-sections sometimes because of that.
Potentially, there's just so many different parts and pieces to that I'd have to say it just depends. But
Yeah.
one of the things that I work with women who are about to have a baby,
Mm-hmm.
we work on a few different things, right? So we work on the pelvic floor as well as cranial massage to work on everything being able to loosen up and kind of, the pelvic floor's main function when you have a baby is just to get out of the way, right? Like
Oh,
if it doesn't get out
vamoose.
of the way, you
Yeah.
can't have a baby. And
Right.
so that comes back again to the pelvis and the bones in the pelvis. And so
Uh-huh.
we have a couple different sections of the pelvis where the baby passes through. We have a pelvic inlet at the top of the pelvis, and we have a pelvic outlet at the bottom of the pelvis.
Mm.
And they tie into different phases of labor. And so I will
Hmm.
go over exercises with women who are about to have a baby where it works on opening the pelvic inlet and outlet so they know when to do these exercises in the different phases of labor. So that can help as well with dilation.
Yeah, that's really, so you could, have you had people come to you just to prepare their bodies for delivery? I mean, are they coming to you even though they haven't had any other issues
I have.
necessarily?
Unfortunately, I don't get a lot just because they don't know.
Yeah.
They don't know to come to me. They'll go to a birthing center, but the information there is very limited as far as what they know about the pelvis and the different muscles and what's happening, during pregnancy, throughout the trimesters, as well as the phases of labor. And so it's information I have that someone else might not have.
I mean, this seems like an entire field that should be created.
Absolutely.
I mean, honestly, I can't imagine I would have loved to have something like that where I actually kind of understood what was happening inside my body, because it's a mystery. Even though you are having a baby, it's still a mystery. And to have someone physically and, mentally and kind of get you in touch with everything that's going on, it seems like it would really reduce the level of anxiety that always accompanies, 99.9% of the time accompanies delivery.
Absolutely. And just being a physical therapist in general and knowing how my body works, not just my pelvis, but everything, is such a huge gift. So being able to understand that has helped me so much with so many different parts of my life, with exercise and, of course, with treating patients. And so I think that's a huge gift to be able to give someone, is understanding exactly what's happening in your body, and that makes it a lot less scary.
Every physical therapist I've ever known, and I used to know a lot because I actually was thinking of going into it and actually was studying it for a while and worked in the field when I was really 18, 19. Everyone has been in such good shape, yourself included. You're a huge athlete, mountain climber, and, exercise every day. And and I think what must happen when you become a physical therapist is you just learn to appreciate how the body works so well, and you want it in its best working order.
Absolutely, because I get a reminder every single day at work of what can happen to your body, right?
Yeah.
And so I'm very appreciative when I don't have any kind of injury or aches or pains, and I take advantage of that time to use my body and see what I'm able to do with it, which is amazing.
Yeah. Wow, that's really interesting. Yeah, I don't think people understand all the benefits of physical therapy. But and you had mentioned to me also that you said, or maybe you've said it earlier tonight, that there is a taboo, but against getting help for pelvic floor issues. But did you mean from physical therapy? I don't know if it's really a taboo, but maybe a lack of knowledge more than a taboo. But I mean, because I don't think of physical therapy as being out of the mainstream even at all. Do you? I mean, do people think of it as being out of the mainstream as far as medical?
But not associating it with pelvic floor, right?
Okay. In general,
you said yourself, you don't understand exactly what a pelvic floor therapist would do,
right?
And I guess it's more of the taboo of the subject matter, not necessarily physical therapy, but the parts and pieces we're dealing with, right? It's a very intimate subject, and most people don't talk about it at all. And if they do, they might be talking to someone else that's like, oh yeah, I've had that for years. It's just, part of being a woman, and it's really not. It's very, very common, but again, not normal. So there's all kinds of things.
And you're talking about incontinence or slight incontinence, things like that. Yeah.
Incontinence, pain with intercourse, all of that's very normal, very common, but it's not normal.
So maybe it would be helpful to understand what you tried. I don't know how to do this without getting way too graphic, but what are, you said you can do physical therapy or exercise like cardiovascular, and you can do other kinds of things, but what are some other treatments that you can talk about that are helpful, or can you? Is that appropriate?
Sure.
Yeah.
So it's a lot about the brain. It also depends on the type of incontinence. You have two different kinds of incontinence with urinary incontinence. So you have
Mm-hmm.
stress and then you have urgency. So stress is usually related to the stiffness of your pelvic floor. So when someone sneezes, coughs, jumps, they'll leak a little
Oh.
bit. So that's called stress incontinence. Then you
Mm.
also have urgency incontinence, where someone is like, oh my gosh, I have to get to the bathroom right now, or I'm not going to be able to control my bladder, right? So with that type of incontinence, it's usually a lot more retraining your brain, retraining your habit structure. I have people keep a bladder diary, right? What they eat, what they drink, if anything seems like it's a bladder irritant to them, do they get up at night and go to the restroom? And then with stress incontinence, that kind of comes back to the diaphragmatic breathing that I was talking about.
Right.
It plays into both types, but with stress incontinence, the first thing that I address is typically it's like a stiffer pelvic floor. It doesn't move. A lot of people like to use that term hypertonic pelvic floor has been out there for a while, but it's more having to do with like a stiff muscle. So if it doesn't go down, the muscle can't contract up. It's kind of like a stuck door, right? Stuck on its hinges. You're not going to be able to contract it very well, right? To keep everything in when you sneeze and cough if you're not able to relax it too. So we work on diaphragmatic breathing, and hip mobility is where I start with those patients to get their pelvic floor moving first. That's the very first thing that I do, is get their pelvic floor moving and have them work on diaphragmatic breathing.
See, that is so easy to hear and easy to imagine doing. It's not at all threatening. So, because I know a lot of, and that would work, a lot of those would work for men as well, right? Whether they went to you or to another one, because I mean, that is, it's definitely a problem for men as well as women, and maybe a little bit more for women because of having babies and all that. But I just think it's really good to know that it's not invasive or anything. It's just, it has to do with the brain and with exercising. And so let's talk about, if we can, just like the pain of intercourse. What's that? What kinds of things, like what causes that? I'll just say I read an article about a woman who was, she said her entire life changed when she went to see a physical therapist for this pelvic floor disorder, because she was never able to wear a tampon, for example, in her life. The pain was excruciating, and she didn't want to tell anybody, but she just lived with it. And then she was afraid of ever having sex because she couldn't even, use that. So her entire life changed from going and getting the help. But, I guess that might be more common than I know as well. I don't know.
It is, and there's so many different reasons why someone might have pain with intercourse. There are some different ethnicities that are more prone to having a smaller vaginal canal and having smaller anatomy. So obviously having less space for everything is definitely going to cause some discomfort. So you have to find ways to adapt that tissue specifically. And then, of course, there can be a history of sexual trauma, which can create a reaction in the brain of anticipatory pain. And that can kind of build on itself too. So maybe you had a little bit of pain one time with intercourse, and then that anticipatory pain actually builds. So that yet again goes back to the nervous system. It pretty much always comes back to the nervous system and the brain. Physical therapy tends to lead the way as far as chronic pain goes, pain neuroscience, and I would say that's no different for pelvic floor PT either.
I think people don't know about physical therapy in general, because it sounds to me like you're part psychologist, psychiatrist / physical therapist, because you're saying if there's trauma of some kind, and this might be for all the things you're talking about, but at least for sexual activity, like there's trauma around there, you start with the brain. You don't start with any, right? That's the first go-to.
Yeah. Because otherwise it could just continue to build on itself, right? It could be compounded if you start with the actual physical tissue. You do have to start with the brain.
Yeah. So you must have to really talk to people in a way that is loving, compassionate, puts them at ease. I mean, is that as much of it as, that feels like almost a necessity.
Absolutely. I mean, we even have like a consent form for people to sign, just to, say they have the option of having someone in the room with them if they want, and if they don't have someone with them, that they can bring someone with them next time, right? Because they have the support that they need. That's also one of the reasons I would never do a pelvic floor exam on someone on the first visit. If I were going to utilize that as a tool, I want to make sure I build that rapport first, build that trust, make sure they know that, I'm not going to add to any of their pain or discomfort or their shame, but we're trying to build that up.
Yeah. So every time they come in, you're building the relationship as well as everything else to try
I
to.
think that's absolutely crucial, and it would be crucial for me too, right? If I went to a pelvic
Yeah.
floor therapist, I would have to be very comfortable with them
Yeah.
discussing some of the things that we talk about. Because
Yeah.
I have so many women that come in. I would say 95% of my patients just have no idea what they're walking into, right? A lot of times their physicians will prepare them if they're being referred to therapy for other things, but the physicians themselves, again, don't know even what
Gosh.
physical therapy is going to do. And so they come in just having no clue what to expect. And so there's a lot of, guarding and discomfort initially, and it's hard for them to
Yeah.
trust because they just
Yeah.
don't know what they're in for.
Yeah. My goodness. I know you mentioned something about surgery too, that this is like an alternative sometimes, or can be an alternative. And this is where I want to be careful, because if someone tells their patient they need surgery for something, you don't want to say, well, they disregard that and go to a physical therapist for it. But how does that happen? Like, are there stories that you can talk about, or situations at least, where surgery has been recommended and was able to be avoided, or anything like that? Or when do you need
Unfortunately, I have
surgery?
way too many of those stories.
Ah, really?
Yeah, so I feel like the amount of patients that I've had, especially with older women who have been going
Mm-hmm.
through this for a very long time, they come to me, and once we have a few sessions and they start seeing improvement, they get very angry at the fact that they've had these different types of like bladder mesh surgeries that didn't do anything, or maybe they had a bladder stimulator inserted into their body that didn't do anything, and then they were on all these medications that had side effects and they didn't do
Mm-hmm.
anything.
Mm-hmm.
And they get angry that they weren't sent to physical therapy first, because it should be the first line of treatment, because
Mm-hmm.
you can always try it, and if that doesn't work, then you can do surgeries and medications. But of course, you should go with the most conservative thing first, which
Yeah,
is just using
right.
your own body to try and get yourself better. And then if you need some alternative treatment, something that's a little bit more aggressive, then that's what you need. And I'm glad we have
Mm-hmm.
that option to
Yeah.
go to. But a lot of times physical therapy will do the trick, and you don't need to have any of those invasive procedures.
Mm-hmm. Can you think of any of your patients that have experienced that, like specifically that, came in, like, do you have like a specific example, or
Yeah.
can you do that? Yeah.
I even had someone yesterday. I had an evaluation of an 87-year-old woman. She came in with her husband, and she's had the bladder stimulator inserted, and she's had one bladder mesh surgery, and she's been on many medications, and she's never tried physical therapy. She's 87 years old.
Mm-hmm.
So we
Yeah.
just started, and it might take a little bit of time to teach these things, because they're going to be especially foreign to her.
Mm-hmm.
But I know that no matter what, I'll be able to help her. I'm not going to say that I'm going to make her symptoms 100% at this point, because it's been going on
Yeah.
for so long and
Yeah.
it's so chronic. But I know no matter what, I will be able to help her with management and decrease her symptoms, if not, potentially solve everything.
Have you ever, it reminds me of my mother at 80, she passed away about that age, but I know she had to have, I don't know, my terminology is going to go right out the window, but she wasn't able to go to the bathroom anymore and had to use, a bag. I don't know what that's called when they have to do that when you have to go to that extent that you're not using the bathroom anymore.
Sure.
And what's the terminology that you have to use?
As far as like what device you have to use
Yeah.
to hold it?
Yeah.
I don't know if there's a specific term for like not being able to use the bathroom anymore that I know of.
Well, no, I just mean like then you have to use a bag and empty the bag. I don't know what that.
Right. So there's like a catheter for urination,
Okay.
but it'll collect
Yeah.
into a bag as well.
Yeah.
I actually
Okay.
don't remember that there's like also a bag for your colon as well to collect feces
Right. Yeah.
if you're not
Well,
able to.
I'm just wondering, that was the hardest thing that ever happened to her in her life. Like all the different things, that one, she felt such a loss of dignity. She didn't want to, like, it really affected her mental health a lot, having to use that and, have people change it and people help her. Is that something, I know that every case is different, but have you ever heard of a case where somebody was able to use physical therapy to avoid that situation?
So that's a little bit more challenging, especially because I don't treat neuro when it comes to physical therapy. I'm level 1 and level 2 certified, and level 3 is treating male anatomy as well as neuro. So I'm not a neuro.
What do you mean by neuro?
What I mean by neuro is someone who might have had a spinal cord injury or a nerve root injury. I've seen a couple of those patients, not spinal cord, but having some nerve
Oh,
root compression where we've
yeah.
gotten something back. But if we
Mm-hmm.
weren't able to and I wasn't seeing progress, that would be someone that I would have to find a neuro PT for,
Oh,
because it's a little slightly different as far as the treatment goes.
well, this was just a case of having 6 children and, just things quit working. So I don't know if that's neuro or not, but,
Yeah.
it,
So, I mean, it just kind of depends. That's someone that I
yeah,
would love to
yeah.
work with before getting to that point, though. Because,
Yeah,
like I
I
said
guess that's
before,
why,
there's no reason not to try because there's no side
right.
effects. There's
Yeah,
nothing that could be harmful about physical
yeah,
therapy. So there's no reason not to try it and give it
yeah,
a shot.
yeah. As far as postpartum women, how has that helped them? Like, what do they typically come in for, and what kinds of cases have you seen that you've been able to help with?
Absolutely. So prolapse is something that's common, especially for faster deliveries where women have to push really quickly and labor progresses a little faster than it should.
Oh,
And so
yeah.
you can have, tearing of the pelvic floor, and you can
Mm-hmm.
also have a couple different kinds of prolapse. And
Can
so
you
I'll
explain?
assess
Everyone always uses that term prolapse, and it's just its body part moving out of where it's supposed to be, right?
exactly.
Essentially.
So you have three different types of prolapse that you can get. You have the vaginal canals surrounded by three different structures. So the top is your cervix. So that
Mm-hmm.
can come down into the vaginal canal. And then in
Mm.
front, you have your bladder, and that can come down into the vaginal canal as well. And then
Oh,
you have your rectum behind that, which can come into the vaginal canal. So the most
okay.
common one is for the bladder to come down into the vaginal canal. And usually that comes back up. But again, we have a window with postpartum women where it's going to be more effective if we do it earlier on. So if we
Mm.
do the internal assessment and kind of see what we're dealing with as far as severity, but working
Mm-hmm.
on approximating all of those structures, so your abdominals, your pelvic floor, everything that's going to keep that prolapse and bring it back in, we really
Mm-hmm.
need to do that early on because you're going to see the best results and have the best outcomes as opposed to the women that I see 5, 10, 20 years down the road who've had prolapses with babies and nothing was ever done for it with
And is
physical
that too
therapy.
late at that point for people to kind of use physical therapy?
That's another thing where it kind of depends on the level of prolapse and exactly
Yeah.
how far it's
Yeah.
gone at that point. I've had
Mm-hmm.
some that are close to the point of potentially needing surgery. You can also have a lower level of prolapse that never fully corrects itself. But if you get your pelvic floor really strong, it can make you have no symptoms of the prolapse.
Oh, well, that's good. Yeah.
Yeah.
That's why you'd want to do anything, right? Just pretty much to have
Yeah,
symptoms.
exactly. To resolve the symptoms.
Yeah. I was surprised when you mentioned something about female athletes having trouble because I mean young girls. Um, that I know we're going kind of jumping around topics a little bit, but um, I think that was more to do with incontinence again. But what would happen as an athlete to have a problem? Is it from running too much? Is it from some kind of activity that you're doing too often? Like what would cause
So most
that
of those
problem?
athletes, I see that type of incontinence called stress urinary incontinence, where you have a stiffer pelvic floor that's not moving. So it's not necessarily due to weakness, it's just a really stiff muscle that's not able to fully contract because it can't fully relax, right? So there's
Huh.
dysfunction in the muscle with its ability to expand and contract. And so if you have that really stiff muscle, it's not going to be contract up and in to control your urethra and keep you from leaking urine. So that's really common for athletes to have leaking with jumping activities because it creates so much intra-abdominal pressure
Oh,
with that high impact that they end
yeah.
up leaking. And that also typically, because of that stiffness, can sometimes lead to pelvic pain as well or painful intercourse. So a lot of my younger female athletes, when I see them, that tends
Hmm.
to coincide. So they'll have both. So they'll have stress urinary incontinence as well as pain with intercourse. So it has nothing to
Really?
do with them being weak. They're obviously very strong and they're able to perform
For
really well
sure.
at their sport.
Yeah.
So I think that that's a little bit of an issue as well, as they worry that they're having to deal with some kind of weakness when they're used to being such a strong person, and that's not what it is. It's just getting
Yeah.
the mobility and the motor control back over your pelvic floor, which happens really quickly, especially with
Does, especially
those
with young
type of
athletes.
athletes that have really good body awareness, right? And they're
Yeah.
able to feel their
Yeah.
muscles more, and so they progress very quickly, which is great to see.
I love that term body awareness because I think it's so big. And I think it's so underrated. I mean, I'm doing these stretches now that are very unusual. I'm taking this little course, and it's stretching me into these ways, and I'm like, I it, that's literally what I feel like I'm getting is more body awareness of things that where I can move, and I think you tend to lose that with age. You get less. I don't know. I don't know what the term would be, but what is that something that is a physical therapy topic, like body awareness, like just, and if so, what does it mean? Like how would you describe what it means? Because I'm not doing a very good job of describing what I mean by it.
Well, it does get pretty complex, so that makes sense.
Mm,
Um, Typically, and it's not
very nice.
necessarily being younger, right? I think it has to do with how active you are, the different, like having a lot of
Really?
variability in the activities that you do, because you're going to have
Mm.
more control and you're going to have to think about things a little bit more, right? I think,
Oh,
using a mirror can be really helpful because you're matching up with your brain and your sight exactly how your body's positioned, which can help with balance and just your
hmm.
form with different exercises. And so you take in that awareness a little bit better when you can see it visually. But you're right, we
Huh.
absolutely, I don't think we necessarily lose body awareness as we get older, but we lose a little bit of the proprioception in our joints, which is the little receptors in our joints that tell us where our body is in space, right? So those can degenerate, especially if you're
Oh,
not a very active older individual and you haven't
okay.
worked on balance. And so there's a component of your brain as well that connects with balance too that can degenerate. So it's a little bit of both of those.
So what do you recommend to people to increase their body awareness? It sounds like you're just saying be more physically active and change up what you do. I know you said use the mirror, but how important is being just active and balanced? Is that the most
Sure.
important?
Well, if I'm dealing with someone who really has a significant lack of body awareness, we start kind of foundationally with dissociating different joints. So I wouldn't give them
Hmm.
some big compound movement like a squat to an overhead press or something like that, right?
Mm-hmm.
Because they're doing that as one big motion and they need to be able to dissociate those different joints first and know that their hips can move differently from their low back. They don't have to move
Oh,
together. There's different
yeah.
segments that move at different
Articulating.
times,
Yeah.
right? You can dissociate your knees and your ankles, and those can all move separately. And then once you learn that
Yeah.
foundation, it can help with the bigger movements and decrease risk of injury overall.
I just feel like that is rarely spoken of in any exercise class. And it's so important to think about things as being separate, like your wrist from your arm, from your knee, from your ankle, and I mean, just to separate it out. It is a rare conversation that I have heard that, and I can tell the difference it makes. It's absolutely huge. The
Because you
more that
have to know
you,
how they work separately in order to understand how they all work synergistically and work together,
right.
right? You have to know how they work separately first, and then you can learn how they all work together.
But not necessarily through a physical therapist, right? Like you could just take an exercise class that has you go up on, or on, you don't need a class, just go up on your ankles just to feel like, just to move different parts of your body seems like it would really help, not having to necessarily get therapy on it, but just to prevent that from happening, just
And I
moving a lot.
definitely recommend that to my patients when I discharge them. I
Mm-hmm.
express how important variability is in movement and like try different
Mm-hmm.
classes, try different things because it
Hmm.
will be helpful to go different classes because an instructor will have different types of cues, right? Then some
Yeah.
cues are going to work better for some people than others. So,
Yeah.
some might click with an instructor where the other instructor you did before, the cues didn't
Right.
click.
You
So
hear
I
things.
think
Yeah.
variability is huge and learning from different people as well who have education as far as
Right.
physical fitness goes and physical training.
Yeah, because I people also tend to get into the same exercises. Like now I run and then I bike and I lift weights and that's it. And that sounds like you're working out, and you're doing great. You're 70 years old and you're doing all these things, but you're doing the same thing every day, and then you're always.
And
Then
I
you
run
really
into that
lose.
trap myself, even though I like to do a lot of different things.
Yeah. Well, we all.
I like to climb, I like to do gymnastics, I like spinning, I
Yeah.
like yoga, I like weight training. But I've definitely gotten to those points in my life where I'm like, oh, that's right. I've been like just getting on my spin bike and doing a little bit of stretching after for the last couple of weeks,
Mm-hmm.
and I will
Yeah.
start to notice certain parts of my body not feeling as good. So
Yeah.
I, in particular, do really well with variability and making sure that I always have something different each day. And it's not just about your body, right? It's about your brain too, because you don't want to get
Yes.
too much into a routine. You need to break
Right.
out of that sometimes because it's really good for your brain.
Yeah. Yeah, it really is. So are there specific exercises that women can do? Let's say they're not going into physical therapy. Maybe they're not even having a problem, but they want to prevent a problem. And everybody knows about Kegel exercises, or maybe not everybody, but that's probably, if you ask people, that would be the only one they did know, if they knew any exercises that would help with that whole region. So are there
Sure.
things that you do or recommend to clients that are, that you can just describe without without someone coming in to see you?
Sure. And but usually it's a little bit more effective if it's tailored to each patient because everyone presents a little differently. But it always, no matter what, for anyone, does start with diaphragmatic breathing. So breathing is very underrated. So I've mentioned a little bit of that already.
Yeah,
But
I'd love to know more about that, actually.
yeah, so Kegels, I'll have women that come in and they're doing a lot of Kegels. But going back to that door analogy, right? If you're doing Kegels and you're just doing this, you might not really be doing a full Kegel. So if you work on the diaphragmatic breathing, you can work on your pelvic floor actually relaxing, which means you're going to be able to contract it more. So we work on that mobility first because you need to have mobility in a muscle before you can have strength. So you can do Kegels all day long. I've had plenty of patients where they're like, I do tons of Kegels, so I know I'm really strong. I don't know why I have this issue. And I'm like, I'm sure you're strong. However, you don't have the mobility and the motor control of your pelvic floor, which is what we need to work on. You're likely to have dysfunction. So we always work on the motor control and mobility of the pelvic floor first. So restoring the mind-body awareness, work on activating different parts of the pelvic floor because it spans the whole lower portion of the pelvis. It goes all the way from your pubic bone to your coccyx, your tailbone, right? So it's a large area that it covers, that it encompasses. So getting out, honestly, you kind of have to also get out of the pelvic floor to get into the pelvic floor. So if you're,
say
if
more
your
about
diaphragm's
that.
not moving, you can't do diaphragmatic breathing, right? So it kind of goes all up the chain of your body. So if your rib cage and your spine don't move, and that means your diaphragm can't move, which means your pelvic floor can't move. So I have some women where everything is so restricted in their rib cage and in their thoracic spine, right, which is your upper body. It's all those vertebrae that attach to your rib cage.
Yeah.
So if that's not moving, it means your diaphragm's not going to be able to expand and contract either. And you need that in order to have control over your pelvic floor. So I will work on a lot of things with women who are really restricted first, just to get their rib cage moving. So work on breathing exercises, working into mobility such as thoracic rotation, thoracic extension, flexion, side bending. Getting their rib cage to expand first is really important. I'll also sometimes do some manual techniques on their diaphragm as well, trying to loosen everything. I also will even get to the point of doing dry needling, which is a whole other thing. But I will sometimes dry needle their abdominals because, again, if your abdominals aren't moving, your rib cage and your thoracic spine can't move. So everything truly is connected, and we have to know what's restricting what and address that first. And a lot of times, to get into the pelvis, you have to get fully out of it first. So there are so many things women can do.
Yeah,
but you usually do need a tailored program because if you don't know what the dysfunction is, and you haven't been to see a pelvic floor PT, these exercises may or may not be the most beneficial. So you really should have something tailored. And it just comes down to how much body awareness you have, how much mobility. Everyone is just so incredibly unique that I treat.
It's funny because I just today was doing these, I told you about these stretching exercises I've been doing, and it's just an online program. But that's literally what I did today is you had all these pillows and you lean back over it and you stretch all these things. And it felt like you stretch your ribs and you stretch this whole area just backwards. And it was, gosh, I felt good. Like shocking. I'm like, so I know that I have that issue. And you're right. But these are things that you would do if you took yoga and if you took, different exercises to move you. Anything that moves you breaks things up, right? Because you were saying you might need a tailored program to come in, but if you're not having a problem that you're aware of and you just want to stay healthy, you're probably not going to go in and see a PT, but you still might just want to engage in, like you were saying before, a lot of different stretching exercises. It's not just physical. It's not just lifting weights and cardio, right? It's a lot of yoga and a lot of just, you said, body movement, just loosening things up. And that keeps you healthy all the way through.
And I would say, I'm just yet one more time going to come back to the diaphragmatic breathing. My one recommendation that I would have for women who are really active and they do yoga and they're good at yoga. I've had so many women come to me that are active and they love to do those mobility things and they're very flexible. But then they come to me with an inverted breathing pattern. So they're doing the opposite of what they should be doing with the breathing, which is going to restrict everything more. So it can be slightly counterproductive. I also have my own theory on one of the reasons that women have pelvic floor dysfunction is we're taught as young women to like suck it in. And so it's a very passive way to suck everything in. You're not actually contracting any muscles. And so that can lead to pelvic floor dysfunction as well.
Wow.
And so I think a lot of women can't help but suck everything in when you're actually supposed to exhale to contract those muscles. So if you don't have a diaphragmatic breathing right, that's something I would recommend you review. And I mean, just even look up online how to do diaphragmatic breathing the right way, and then incorporate that into your yoga, your Pilates, lifting exercises, right? Knowing how to exhale on the effort always. Don't inhale to brace, but exhale. And that's because inhaling can actually cause more stress on your pelvic floor if you inhale to brace. And that can cause more dysfunction and it can cause more leakage. So knowing that exhale on the effort with your breath is really important.
Is that something that you can do like here right now, or is it not appropriate for the setting? Like just to show how you do a deep breath? Because honestly, I don't even know. I'm obviously doing it wrong because I know they always say exhale with the effort, but I don't really pay attention.
Sure. So again, you have your diaphragm under your rib cage here, right?
Yeah.
And then you have your pelvic floor below that. And then you have your abdominals here. You have this corset muscle called your transverse abdominis that kind of wraps around your internal organs. And so those three muscles work together to control your pelvic floor, but also to perform diaphragmatic breathing. So when you do a diaphragmatic inhale, you want to try to learn how to isolate your diaphragm, which means your chest shouldn't be moving, right? So if you do a really quick inhale through your nose, your chest is going to puff up, right? You can't help that if you do a quick inhale. And that's what you do when you cough and you sneeze is you do a quick inhale and your chest puffs up. So if you do a really slow, passive inhale and work on filling your belly up like you're blowing up a balloon, right? And your lower abdomen.
You let it push. You push your stomach out. You literally push it out, right?
You don't push, but because inhaling is a very passive activity, so you don't want to be pushing anything. Like that can lead to dysfunction with like bearing down and bulging. So we don't want to do that. So inhaling should be slow and passive. Like you want to inhale for at least a count of 5. You don't want to inhale too quickly. So it's like you're allowing passively that balloon to fill up in your lower abdomen. And then when you exhale, you want that to be, that's the active component, right? That's when you're going to be contracting your pelvic floor. So you want that to be very active and powerful, like you're blowing through a straw. So instead of just like you want to do a through pursed lips, like you're blowing out a candle that's really far away, right? The more pressure you add to your exhale, the more you're going to be able to actively contract your pelvic floor. So inhaling through the nose slowly and then exhaling very powerfully through your lips with pursed lips, that's kind of where you want to start accessing and controlling your pelvic floor.
You know, you really have to practice that when you're not trying to do anything else, like exercise or lift weights. I mean, because that's what I'm always trying to do while I'm trying to do the exercise. And I think it really helps. I'm just going to do exactly what you said. Just keep trying that without anything else going on. It's the simplest thing, but if you don't get it right, you're messing up everything.
It's crazy how simple it is. And yet, if you don't have that foundation, right, of that one simple thing, you're not going to be able to do the rest the way that it should be done to protect the pelvic floor and strengthen it. So
and such huge ramifications. Yeah, I mean, big ramifications of not knowing how. And it doesn't. But what gets me is it doesn't feel like it's causing. It doesn't feel like the natural way that we breathe. Why? I don't know why it should be different from how we just breathe naturally.
The reason for that comes down to our bodies wanting to take the path of least resistance, right? We want to do the thing that's most energy efficient.
Right.
And that's typically not contracting muscles. It can allow muscles to be inhibited if your body doesn't feel like it's necessary for the activity, right? that can inhibit
Yeah.
muscles from
Yeah.
actively working. So you have to train them. You have to engage them. One of a really good example that people might understand a little bit better is
Mm-hmm.
your glute muscles, right? Those are the biggest muscles in
Mm-hmm.
your body.
Are
And
they?
those are actually completely passive when you're walking. So they don't work at all. You have some lower hip rotators that work in your hips that are underneath your glutes, but those big glute muscles don't actually do a thing when you're walking.
Huh.
So you have to train them through squatting and activating them because it's a
Oh,
large muscle and your body's not
yeah.
going to want to use it unless it has to because it takes a lot of energy
Oh,
to
it's
use those big,
so
powerful
interesting.
muscles. So that's a
Yeah.
muscle that can often get inhibited, and your pelvic floor can too. It's the same concept.
We're our own worst enemies. Well, Caleigh, gosh, I cannot believe the amount of knowledge you have just at the tip of your tongue and at the tip. I mean, you're amazing. You know all the answers. I wish I had something to try to stump you with, but I don't have anything, so you're off the hook. But I do want to just cover actually one more area, and that is we were talking earlier about how like somebody may somebody may hear this and want to go get help or get a session with a therapist like yourself. How do they do that, and how could we get the word out just throughout society that this is a really valuable tool that we're not taking advantage of?
Absolutely. So
It's a
I'll always
compound
check with your
question there.
insurance, like depending on your state. So I would check with your
Mm-hmm.
insurance first. That's going to be the most important.
Yeah.
Typically, if it's a federally funded plan like Medicare or Medicaid, they're not going to cover it unless you go to a primary care physician first to refer you. But if you
Okay.
have a private insurance, check with them first and make sure that they cover direct access, is what it's called, where you can go straight to a physical therapist on the state. We're in Colorado, so it doesn't matter what private insurance you have. You can go straight to a physical therapist at any time. So if
Is
you
that for
want to,
anything you're saying? Like, so it could be for pelvic floor, or it could be for any kind of
anything, you
physical
sprain an
therapy.
ankle,
Okay.
I recommend coming to a PT first because we're
Oh,
going to do way
really?
more for you than anyone else is going to. So you sprain an ankle, something along those lines, right? If it requires
Yeah.
imaging like an X-ray, we can also refer for that in Colorado too.
Yeah.
So I can send you in
Huh.
for an X-ray or an MRI if I
Okay.
think it's necessary. So
Yeah.
the reason that we have
Huh.
doctorates is we're able to screen for that. So if we believe someone might have a fracture or something more serious, we will refer them to imaging first before treating them.
Hmm.
So that's
Okay.
one of the reasons they can come straight to us. So it's no different
Okay.
with pelvic floor. If you have
Huh.
pelvic floor dysfunction or you just want to know how to train your pelvic floor appropriately and you don't even feel
Mm-hmm.
like you have any specific dysfunction.
Right.
I actually had one patient come to me who she has her own podcast and she's a journalist and she
Hmm.
talked to a pelvic floor therapist on her podcast and
Oh,
learned a
really?
lot about it and was like, oh, I just
I
want to
thought we were
do
breaking
it.
new territory. All right, go
Yeah, I
ahead.
know. Right?
No, I'm
Been done
happy to
before.
hear that. Yeah. Okay.
So she came to me just because she wanted to learn how to strengthen her pelvic floor. Because
Hmm.
a lot of times urinary incontinence and pelvic floor dysfunction relate a lot to back pain. So if you can strengthen your pelvic floor, you
Hmm.
can strengthen the rest of your core muscles all day, but if you don't strengthen your pelvic floor, it's not as effective for stabilizing your spine and preventing low back pain and low back injuries. So that's another reason to seek PT especially if you're a female who has low back
Mm-hmm.
pain, even without
Hmm.
incontinence. Try, especially if you've already tried physical therapy for your low back, try pelvic floor
Oh.
PT because that's going to
Oh.
have it's going to come at it from a different angle and train the foundational muscles first. So I've had a lot of good results with that with my low back pain patients as well. So
Hmm.
going back to
Okay.
just how to find a physical therapist, I'd say
Yeah.
start with your insurance, make sure that that's covered. But then you also might need to, if you need a referral from your primary care physician, you might have to educate them on why you
Oh.
want pelvic floor PT, right? And what
Yeah.
you've heard about it. And that would
Mm-hmm.
be helpful to other women, right? If you're able to do that
Yeah.
and educate
Yeah.
your own doctor on, what you've heard it can do and why you want it.
Mm-hmm.
So that would be one way to help with physicians being a little bit more educated on what pelvic floor PT is, why they
Yeah.
would refer for it, right?
Okay.
And I think that's extremely important as obstetricians and gynecologists really knowing what it could do, whether you're pregnant or postpartum, or have incontinence of some kind, like why physical therapy would be helpful and what it does.
Mm-hmm. Hmm. Do you think insurance would cover if someone were pregnant and they had no problems and they just wanted, I mean, is that something that's often covered, that they just want help with being pregnant, with delivering the baby and preparing for
Absolutely. I see
postpartum?
that all the time because,
Do you? That's so
yes, because
fascinating.
it does improve outcomes later, right? So it's a type of
Mm-hmm.
preventative care, which I
Yeah.
wish physical therapy did more of, like a prophylactic type care, right?
Mm-hmm.
Because
Yeah.
if you're
Yeah.
helping to prevent injuries and improve outcomes after a surgery or delivering a
Mm-hmm.
baby, that's absolutely something an insurance could cover because they're spending less on PT when they cover that, with
Right.
insurance as opposed to some expensive inpatient procedure they end up needing to have. So, um,
Right.
they cover it because it improves outcomes overall. So
Do are there are there people like you? Are people doing the work that you're specializing in every state, or are there just like certain states that are doing it right now and it hasn't spread to all 50?
it's everywhere. I don't know exactly how prominent it is in one state versus another, but I
Mm-hmm.
have practiced in a couple different states, and I went to school in another state, so I know at
Mm-hmm.
least in those three states it's definitely
Yeah.
available, and it's talked about more, on a widespread level, which is good.
Mm-hmm.
It just needs to be talked about more. But I don't know of any specific states that don't seem to have it.
Right. It's just the number of people doing it might be pretty minimal. The number
Correct. Yeah.
number
So
of
the
people
access
with
might be
that
worse.
specialty.
So especially rural settings, right? Those women are not going to have enough
Right.
access of what they need to begin with, and so pelvic floor PT is going to be even harder for them to
Right,
have.
right. Well, I'm wondering, but does it say, like, if we go to your clinic, does it say that that you specialize in pelvic floor? Like, is that can someone tell before they go into a physical therapy organization if that's a specialty? Like, is it listed
Absolutely.
on?
So they can call for sure and ask.
Yeah,
Our
yeah.
upfront staff knows everything about us. We also have our
Mm-hmm.
profiles listed at the front of
Mm-hmm.
the office, exactly what we specialize in, what we like to treat, a couple
Mm-hmm.
like fun details about our lives as well. And then we have
Yeah.
that on our website too. So it's
Okay.
pretty easy to find in that regard. And we also tell, the physicians that normally do refer to us, we make sure we let them know that we have two pelvic floor physical therapists at our clinic, which is really
Mm-hmm.
rare. Right now it's just me
Yeah.
because my counterpart actually just went on maternity leave because she's having
Oh,
her own baby. So it's actually
but
just me
she's
right
ready to go.
now. She knows
She's
it
got
all.
it
She's
all
very
dialed
prepared.
in.
She's
I
very
kind of
prepared.
that'd be great. Actually, so what is the name of your organization? And I'll put it in the show notes as well. So if people are anywhere near here and they want to go see you, they can. So what's the name of your?
Yeah, so I work for Select Physical Therapy, which owns a lot of different locations all over the United States, and
Mm,
they go by different names as well. And so we're actually a
okay.
center of excellence, so it means that we specialize in sports as well. So we specialize
Mm,
in sports as well as pelvic floor physical therapy, and I work
mm,
at a location in Golden. So
yeah.
we treat a wide variety, but we specialize mostly in athletes and pelvic floor.
Wow. It's a very exciting field that you've chosen, and it sounds like it's getting more exciting. It's becoming broader and more preventative rather than, as you said, prophylactic rather than coming in after the fact. So I'm so appreciative of you doing this because honestly, I didn't know how much I would learn. I feel like I've just been to college. I feel like I've learned so much in this last hour, and from you. So thank you so much for taking the time, for educating people, and for doing the work that you do because you're really, truly, truly helping people.
Of course. I'm glad to have
And
educated you. And even if one other woman listens to this
yeah,
podcast, I'm grateful for that as well.
well, let's hope at least one woman does, or one man who tells one
Maybe,
woman, or
or maybe a couple of physicians. That would be great too.
that would be great. I'll see what I can do to specialize in getting it out to them.
Mhm.
Caleigh Campbell, thank you so, so much for being here. And maybe we'll check in a year or so and see what's changed in the field, and you can take us to chapter 2.
Sounds good. Thank you for having me.
Okay, take care.